Welcome, listeners. Last week, we discussed nutrition and natural remedies that might help depression. Today, we present the medical treatments for the 11 types of depression as presented in a report by Health.com and attributed to several well-known doctors and healthcare organizations. According to the report, depression can present itself in several ways. It can be mild or severe. It can be short-lived or chronic. Special circumstances, like birth of a baby or changing of the seasons, can trigger depressive symptoms as well. Understanding the type of depression a person is experiencing helps healthcare providers determine treatment. And for people who are diagnosed with depression, having information about their specific disorder can be beneficial as well. Folks seem comforted in knowing what's going on for them, said Sarah Noble, DO, a psychiatrist with the Einstein Healthcare Network in Philadelphia. At least they have an answer for why they're experiencing what they're experiencing, she said. Here's what you should know about the 11 types of depression. First, we'll discuss major depressive disorder, or MDD. In 2020, approximately 21 million American adults had experienced at least one major depressive episode, according to the National Institute of Mental Health, the NIHM. Under diagnostic criteria published by the American Psychiatric Association, people must have at least 5 symptoms persisting for 2 weeks or longer to be diagnosed with major depressive disorder. Those symptoms can include feelings of sadness, emptiness, worthlessness, hopelessness, and guilt, loss of energy, appetite, or interest in enjoyable activities, sleep habit changes, or thoughts of death and suicide even. Major depressive disorder has 2 subtypes, atypical depression and melancholic depression. People who fall into the former category tend to sleep and eat a lot. They are emotionally reactive and very anxious, Dr. Noble explained. Those in the latter category have trouble sleeping and tend to ruminate over guilt-ridden thoughts, Dr. Noble added. Young adults tend to present with atypical depression, and the melancholic type seen more often in older adults. Most cases are highly treatable and may consist of pharmacological options, medication, therapy, or lifestyle changes per the National Library of Medicine. However, individuals with major depressive disorder may begin with psychotherapy and medications as their treatment. Remember, this session is not going to discuss alternative means. That we covered July 19th. Treatment-resistant depression, the next type. Sometimes people with major depressive disorder don't readily respond to treatment. Their depression stubbornly hangs on. Maybe it's genetic, maybe it's environmental, Dr. Noble said. Depression is just tenacious with them. According to researchers of a January 2020 neuropsychiatric disease and treatment study, for a person to be diagnosed with treatment-resistant depression, they need to have gone through 2 unsuccessful pharmacotherapy trials. In other words, patients have tried 2 different medications and neither worked for their symptoms. Helping people overcome treatment-resistant depression begins with a thorough workup to ensure a proper diagnosis and identify their other psychiatric and medical causes of their symptoms. Patients are counseled on proper dosage and duration of treatment. If a medicine isn't working, healthcare providers will try switching to a similar drug or one from a different class. Patients may benefit from adding a second antidepressant from a different class and perhaps another type of medicine such as antipsychotic. The next type of depression is what we call subsyndromal depression. A person who has depressive symptoms but doesn't quite check all the boxes for a diagnosis of MDD may be deemed subsyndromal. In other words, they may have other specified depressive disorders as indicated by the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision DSM-5-TR. For example, the person might have less than 5 symptoms or experience depression for less than the 2-week minimum. Rather than look at symptoms, I usually look at functionality, Dr. Noble added. Is the patient able to go to work and take care of day-to-day responsibilities? If the patient is struggling, they may still benefit from treatment, including with medication, Dr. Noble said. Persistent depressive disorder is the next. People with PDD, formerly known as dysthymia, have a low, dark, or sad mood on most days, and at least 2 additional symptoms of depression lasting 2 years or more, per Medline Plus, who wrote about this one. In children and teens, PDD may be diagnosed if symptoms of irritability or depression persist for a year or more. It may wax and wane in intensity, but generally it is a low level of depression, Dr. Noble explained. To be diagnosed with this type of depression, people must also have 2 of the following symptoms: sleep problems, too much or too little, low energy or fatigue, low self-esteem, poor appetite or overeating, poor concentration or difficulty making decisions, feelings of hopelessness. Usually, PDD requires treatment with a combination of medication and psychotherapy. Now, we're giving you these types so that if you know someone or someone in the family has a depression of some type, hopefully this will help you to try to see which one they may have and try to understand them a little better. So we're just providing this as information. The next is premenstrual dysphoric disorder, PDD. Another PDD. Up to 16% of people of childbearing age experience premenstrual dysphoric disorder, actually called PMDD, to distinguish it from the persistent depressive disorder. So PMDD, according to an article published in the American Family Physician, this severe form of PMS can trigger depression, sadness, anxiety, or irritability, as well as other extreme symptoms in a week before a person's period. It can really be uncomfortable, disabling, and interfere with a woman's day-to-day life, said Dorothy Sitt, MD, Associate Professor of Psychiatry and Behavioral Sciences at Northwestern University Feinberg School of Medicine in Chicago. Scientists believe these people may have an abnormal sensitivity to hormonal changes during the menstrual cycle. Taking antidepressants, specifically selective serotonin reuptake inhibitors, SSRIs, in the 2 weeks before their period or throughout the month can be very effective, Dr. Sitt says. Certain types of contraception and pain relievers may help with their symptoms as well. The next is depression due to bipolar disorder. Wide swings in mood and energy from elation to hopelessness are the signatures of depressive episodes in bipolar disorder. To be diagnosed with this form of depression, a person must have experienced at least one bout of mania, which is a period of time with energetic behavior. A bipolar disorder commonly shows up in young adulthood. Bipolar disorder usually worsens without treatment, but can be managed with mood stabilizers, antipsychotic medicines, and talk therapy. The depressive symptoms specifically can be treated with antidepressants, according to the National Institute of Mental Health. The next is disruptive mood dysregulation disorder. Screaming and temper tantrums can be features of disruptive mood dysregulation disorder, DMDD, a type of depression diagnosed in children who have difficulty regulating their emotions. Other symptoms include an irritable or angry mood most of the day, nearly every day, and trouble getting along in school, at home, or with peers. Maybe you know someone like this. These are kids with strong emotional outbursts, Dr. Noble said. They're not just able to contain their emotions, so they act out and act on their feelings. According to the NIMH, National Institute of Mental Health, DMDD is treated using medication, psychotherapy, and parent training on how to effectively deal with a child's irritable behavior. The next disorder, or depression rather, is postpartum or perinatal, they call it, depression, either postpartum or perinatal. The birth of a baby brings enormous joy, but can sometimes lead to postpartum depression, PPD, a type of sadness also called the baby blues, according to the Office on Women's Health, the OWH. While these feelings of emptiness and emotionlessness are typical in the first 3 to 5 days after giving birth, the OWH reports that they can become PPD if they last for longer than 2 weeks. And PPD is fairly common. The OWH reports that 1 in 9 females will experience PPD. In people that recently gave birth, postpartum depression is likely triggered by shifts in hormones, fatigue, and other factors. It can begin at any time in the first year following a child's birth, not just after, although it usually appears soon after the arrival. Intense feelings of sadness, anxiety, and exhaustion become overwhelming and can interfere with daily life. When these feelings become extreme, they can provoke thoughts of hurting yourself or your baby, along with other symptoms. This is known as postpartum psychosis, according to the OWH. Compared to the baby blues, which is mild, short-lived, and extremely common condition causing anxiety and depressive symptoms in the immediate wake of a baby's birth, PPD usually requires treatment with antidepressants, talk therapy, or both. BetterHelp is one of the top-reviewed online therapy options to help guide new mothers through challenging times and provide treatment options. So look up BetterHelp if this is one of the things you're concerned with. The next is something that affects a lot of people, seasonal affective disorder, or SAD. It's a seasonal depression, a recurring type of depression that usually strikes in the fall or winter, but can also occur in summer. Along with a change in mood, individuals with SAD tend to have low energy. They may overeat, oversleep, crave carbs, gain weight, or withdraw from social interaction. Females, younger adults, and individuals who live in places with shorter daylight hours are at higher risk of developing SAD, according to the NIMH. SAD can also run in families, and symptoms of SAD may increase after resetting the clock for daylight savings time. It is diagnosed after at least 2 years of recurring seasonal symptoms. While the exact cause is unclear, research has suggested it may be related to an imbalance of the brain chemical serotonin. An overabundance of the sleep hormone melatonin and insufficient levels of vitamin D may also play a role, per the NIMH. Treatments for SAD include a daily dose of light therapy and sometimes medication. Now again, there could be alternative treatments for things on the market that you might refer to my podcast on July 19th on nutrition for stress, anxiety, and possible depression. The next is psychotic depression. People with psychotic depression have severe depression accompanied by psychosis, which is defined as losing touch with reality. Symptoms of psychosis typically include hallucinations, seeing or hearing things that aren't really there, and delusions, which is false beliefs about what's happening. Additionally, psychotic depression is considered to be another subtype of MDD, major depressive disorder. One of Dr. Noble's patients, 2 years after beginning treatment, confessed that she had a year during which she would not eat anything her father cooked because she thought he was poisoning her. The woman was otherwise lucid. She was just dealing with psychotic depression that had not been fully treated. Healthcare providers usually prescribe antidepressants and antipsychotic medicines together to treat psychotic depression. However, not everyone responds to these treatments. To treat psychotic depression, researchers are also looking into electrotherapy, a therapy that sends small currents of electricity to the brain while a person is under anesthesia, per the National Alliance on Mental Illness, the NAMI. According to a November 2020 Psychotherapy and Psychosomatic article, electroconvulsive therapy, ECT, was found to be somewhat effective as well, though more effective in non-community settings. Again, speak to your professional about any of these. This is just what was on the report of the different types and what could possibly treat them. Depression due to an illness is the next type. Coping with a serious chronic disease like heart disease, cancer, multiple sclerosis, HIV/AIDS can be depressing in and of itself. Researchers of a September 21 BMC psychiatry study found that patients who had been diagnosed with chronic diseases were more susceptible to depression. Disease-related inflammation may also play a role on the onset of depression. Inflammation causes the release of certain chemicals by the immune system that crosses into the brain, leading to brain changes that can trigger or worsen depression in certain people, Dr. Noble explained. Antidepressants may help prolong their life and improve their ability to function, Dr. Noble said, and therapy can help many patients. I hope this helps our listeners understand that not all depression is the same, even though there may be some similarities. One thing is for sure, depression is not to be taken lightly. If someone you know is experiencing these symptoms on a regular basis, you might consider encouraging them to speak to someone about it and possibly seek professional guidance. If they are looking for natural alternatives that might help with some of these conditions, please have them refer to my podcast entitled Nutrition for Anxiety, Stress, and Possible Depression that streamed on July 19th, just a few days ago. Now, one thing to look into for information, I do want to mention because it's not on that podcast, for information in general, one of the most wonderful things that has tons of research in it is curcumin, which is a component of turmeric found in most supermarkets, drugstores, and health food stores. Curcumin is tremendous, and I certainly feel that you can look into this and some of the other things that, or for inflammation online, and try to lessen that in your body if you're just looking for a natural solution. Okay. Remember, listeners, to wake up each morning to something or someone that puts a smile on your face to start your day in a positive mood. Until next time, listeners, goodbye.